Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 91 of the Better Health Guy blogcast series. Today's guest is Dr. Jill Crista, and the topic of the show is Break the Mold. Dr. Jill Crista is a naturopathic doctor, best-selling author, and nationally recognized health educator. Her hope is to improve health through education by bridging gaps in understanding between medical research and practice. She writes books and offers online courses for anyone wanting to gain concrete steps to conquer health challenges. She focuses on conditions that cause injury and inflammation to the brain and nervous system, including concussion, mold, Lyme disease, and autoimmune encephalopathies, such as PANDAS, PANS, and others. Dr. Jill graduated with honors from the National University of Naturopathic Medicine in 2003, and in 2012 completed the physician training program with the International Lyme and Associated Diseases Society. She is passionate about herbal medicine and completed the Advanced Botanicals course with Dr. Jillian Stansbury. For over a decade, she was director and practicing member of 2 integrative medical clinics in southern Wisconsin. She had the opportunity to practice with colleagues from naturopathic medicine, integrative medicine, acupuncture, chiropractic, physical therapy, and massage therapy. Here, she experienced the synergy and efficacy of a team approach to patient care. She's now focusing on researching, teaching, and writing, incorporating what she's learned. And now, my interview with Dr. Jill Crista. The topic of mold is such an important one. Many people think of me as the guy that knows about Lyme disease, but the reality is chronic Lyme disease almost always has a mold component. It is never one thing. And if you're dealing with a long-term health challenge such as Lyme may be part of the picture, but it's commonly not the entire picture. So I urge people to explore mold. It is often a significant contributor to a Lyme condition. And I'm excited today to have an expert in the realm of mold to talk with Dr. Jill Crista. Thanks so much for being here today, Dr. Jill.
Thank you. It's a real pleasure.
Thanks. What drew you to writing a book on mold and to treating patients with complex mold-associated medical conditions? Did you have some personal experience that kind of opened your eyes to mold?
Yes. Well, I ended up learning about mold by treating chronic Lyme patients. I was treating this subset of my Lyme patients weren't getting better. And, in natural medicine, when you address the cause, when you're really addressing the infection, and there aren't other factors, people do get better. And I would say, if I was to give a percentage, it would be well over half of my patients with Lyme got better with the things that we do. And they have to be a little careful about their health, that kind of thing. But then there's this 10 to 15% that were just stubborn cases. And one of those patients, in their home, they found black mold. And that was my first exposure to it. I think I knew about mold kind of in the back of my mind, and I knew it was a bad deal, but I didn't really understand how bad it was and how much it was impacting their whole Lyme story. So then I went looking for mold in the other 10 to 15% of my stuck patients, and guess what? It was mold. So I was already addressing heavy metals, which I think is also a factor. So those were the 25% of those chronic Lyme patients that weren't getting better. And then once we addressed the heavy metals and the toxicity piece, they were getting better. But this mold, it was so stubborn and it caused so much immune deficiency, it just kept them in that chronicity state. So as I learned about mold and developed ways to manage it, I was able to see improvements in those patients. The funny thing is, the thing that really kicked off writing the book was that we ended up with mold in my own home. And that's often the story that why someone gets inspired to teach about something and learn more. And what I thought was really interesting is I came into this knowing about mold, but I didn't recognize it when it was happening to me. And that's what I think is so insidious about mold. I was in the process of writing a book on brain injury, and mold just sort of hijacked it. When I was in the middle of this experience, I thought, oh my goodness, this is all I can think about. It's all I can talk about. I'm in the depths of remediation. I'm addressing my remediation like a scientist. We pre and post tested materials like crazy, which I had done with patients a little bit, but the budget can only sustain so much. So I just took this on as a research project. And I thought, I really need to put this in a book. There are so many people struggling and so many people that can't find a doctor. I'm hoping, through my online course and through Shoemaker's course and just many things that are available online now, that we can get more doctors up to speed, because I think we're missing mold in, probably 25% of our chronically ill patients, if not more.
I would absolutely agree with that. In the book, you have a great list of mold-associated symptoms. What are some of the key things that kind of clue you in your patient population? Maybe the things that are unique to mold that might make you go, yes, I think we really need to explore mold here. Are there some specific things? I know there's a lot of overlap.
A lot of overlap. Yeah, it's that thing with Lyme and mold. The Venn diagram is very overlap. I would say that the number one thing that I saw in every single one of my mold sick patients was some level of anxiousness. And what I find interesting about this as a practitioner is when you're sitting in the clinic and you're talking with somebody about anxiety, many times they'll be, I don't have anxiety. No, that's not a problem for me. Nope. But if you start to describe what anxiety feels like, do you ever have a feeling where you can't get settled on the inside? Do you have a sense of restlessness? Do you have a feeling like you should be doing something all the time and you're missing the boat, or you're forgetting to do something? Do you sense do intrusive thoughts impede your ability to sleep? That kind of thing. When you start talking about the details of it, clinically, that's a pearl I guess I can share. That if you say, do you have anxiety? You'll get a no answer. But if you start talking about how anxiety shows up in the various different miasms of our body, then you get definite yeses. And I don't know that I had a mold patient that didn't have some level of anxiousness. The other would be fatigue. But, we see fatigue with adrenal burnout. We see fatigue with heavy metals. We see fatigue with Lyme. So that isn't really a cardinal symptom. But when you see that combination of fatigue and anxiousness or unsettledness, then I start going, more arrows are pointing toward mold for me. And then there are some little neurological things. Tinnitus, which we can see with antibiotics, and we can talk about that later, why that's a combination problem. Pelvic pain or zinging sensations. And those are things that like a neuropathy, that I see quite a bit. And then new onset sensitivities. So someone was fine before, and then now they can't tolerate burning candles in their house. Then I'm like, okay. So we've got more arrows pointing that direction.
Excellent. I loved in the book how you kind of created an outline or a template characterizing mold. And I'm going to kind of go through the list and then we can talk about these and break them down a bit. But you say mold is a survivor. You say mold has bad gas. It's a bully. It invades your body, causes toxic breath, won't go down without a fight, which I'm sure many of us can relate to, turns you into a wimp, causes cravings, can make you feel crazy, hazy, and lazy. I know we can relate to that one too. Causes allergies, food sensitivities, makes you sensitive to chemicals and to electromagnetic fields. Mold sickness is hard to identify, often misdiagnosed, and is part of a scandalous cover-up. So I think that was a great way that you kind of outlined the book. It's really fantastic. So talk to us a little bit about how mold is a survivor and how common is mold in the homes and buildings in the United States?
Yeah, I consider mold like a Navy SEAL, the Navy SEAL of the microbial world. It has all these survival things already figured out. It can survive like a Navy SEAL. It can exist undetected in your environment. A lot of people think that mold has a scent. It doesn't. It doesn't have to. It's only when it's exposed to air that it has a scent. But the harmful chemicals that affect us seep right through building materials and can be poisoning our air, and we don't even know. That was the case in our house. We were in a new house, and there were some plumbing errors that were part of the building of the house that caused a drip, 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 drip. So here's this mold problem, and it was standing there for years. We were new-ish house. So it didn't stink. It wasn't an old house. Everything looked really good, so we didn't know that was happening. So that's that Navy SEAL thing of like figuring out how to be under the surface and be undetected. Also, it can survive on hidden moisture sources. We have to remember mold is microscopic. So a tiny bit of a water, like my drip, 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 was creating oceanfront property for mold. To me, it's nothing because I couldn't see it because it was soaking into materials, but it was like, enough moisture there for the mold to survive. And then mold has survival. Remember, it existed before humans did evolutionarily. So it has it figured out how to sort of hunker down and wait, make spores, kind of like, Superman and his parents, they just put him in a little pod with all the things that he needed for survival and all the information he'd need to exist in another space, and out goes the spore. And then the spore just tries to find another opportunistic place to survive. So it's got all that kind of survival stuff figured out.
Well, and it's been said that mold is nature's Undertaker, right? I mean, it is intended to help recycle and decompose. And so it would make sense that it would have survival skills and tactics. In those that are genetically susceptible to biotoxin illness associated to mold, what percentage of buildings in this country would you speculate have enough of an issue that they may not be optimized for healing?
OSHA states that 25% of the buildings have had enough water damage to sustain toxic mold. So I would say since we changed our building practices in the 70s or so, I think that number has gone up because we don't even have to have a water intrusion problem. You can have a humidity problem. So if you have an indoor humidity issue in an uber tight house made of paper, we are really confusing the mold on the planet. The mold is like, why are you attacking me? I'm just doing my job. You gave me a humid, encapsulated area, and I'm just doing what I'm supposed to do. So I would say in newer buildings, I think you're more concerned about that if you're not managing your humidity. So we're definitely over the 25% in our country.
Yeah, and I think I've read in some of Shoemaker's work, as many as 50 to 70% even may have some mold exposure, that for those of us that have kind of a higher bar for being able to, or needing an environment to be really, really clean in order to have good health, it's kind of shocking when you really look at the statistics at how common this issue is.
Yeah.
You say that mold has bad gas, and in that conversation, you include the topic of mycotoxins. So tell us about mycotoxins, how bad they really are, and is it the mycotoxin itself that poses more of a risk than the mold spore?
So the bad gas is the mycotoxins and other chemicals. Mold secretes these other chemicals as part of its regular living. And the mycotoxins it makes under a competitive threat. So what's concerning about that is you have to realize that, we all have body odors and things as part of our normal living. But then if we're under stress, those body odors might change. Or if you're trying to communicate like a mother and a child, they have more pheromones and things that are being secreted. Those are more potent. And it only takes a little tiny bit of that to make a difference versus like a VOC or an aldehyde, which mold also makes. We need a greater load of those things to make the impact. People ask me, why are mycotoxins so bad? And part of it is they have no scent. So there's no detectable way to notice whether they're there. It's sort of like natural gas. I would love if we could find some way to add something to the environment so we could tell by smell when a building has a problem. All mycotoxins, every single one of them, affect the health of living beings, pets, plants, humans. They're made to compete out any other living microbe because we talked about oceanfront property. Mold is looking at that property and saying, I want to have my spot here. And then if it detects toxins or intrusion of other microbes, which can be bacteria, it can be Mycoplasma pneumonia. It could be other things that it can exist in a biofilm. And buildings have biofilms, make no mistake. So a sick building has a mold problem, but also a biofilm problem. That mold starts spitting out this toxic gas that can poison and kill or prevent other microbes from coming into the environment. So they're meant to be deadly. That's what the job is of a mycotoxin.
Why, you say mold is a bully. Why is mold a bully, and how does its ability to impact us tie in with our genetic predisposition? And then what percentage of the population is potentially genetically predisposed to mold illness?
So it's a bully. I call it a bully because it picks on the genetically weak. It's this combination of self-survival of the mold, and catching those genetically weak people so that they are the most impacted. And then when they cry wolf, no one else is impacted, so they don't get believed. And that sounds very bullyish to me. Like I already know the one that's going to be whining and complaining all the time about health issues. I'm going to go ahead and just take that person down. And when they exhibit symptoms before everybody else, no one's going to give it any validity. So I think that the numbers are a little tough to tell because our genetics are not our determining factor for our health. There are HLA tests and, our genetics are our genetics, but so is the epigenetic state. That's where I think mold is the most deadly, though, because it impacts us both at the raw genetic level, impacting our ability to make DNA and RNA, and the epigenetic milieu that those genes are replicating under. And in that way, I feel like it's really the bully behavior, because it's impacting even where our genes would go to normalize and impacting that too.
Yeah, so that's an interesting thought. So what you're suggesting is we can have potentially a genetic predisposition that could be epigenetically influenced in a way that makes us more predisposed. But then once we have the mold exposure, that mold exposure is an epigenetic factor that's influencing other genes that then create other problems potentially. So it's kind of this vicious cycle, essentially.
Yeah, it establishes sick behavior, biochemical sickness behavior, that the body can't get all the antioxidants it needs to make healthy genes, and then you replicate unhealthy genes in a sicker environment, and so down it goes.
If you had to guess, is it a quarter, half of the population that might be affected by mold? I know some people can live in a moldy home and they don't feel sick. It doesn't mean long term they may not develop some health challenges, but any guesses on what percentage will develop a mold illness or a SIRS-like condition?
It's so hard to tell because a lot of the people that I see, so we're always clouded by our patient population. The people that I see are people with Lyme disease, with autoimmune disease. Some of us get to attract the people that have lots and lots of issues going on. Mm-hmm. So if I were to guess in my patient population, the people that get locked in and stuck and really need a bump out, I would put it in that 20 to 25% category.
Okay. There is a lot of debate about whether or not mold colonizes the body and potentially then needs antifungal treatment, or if it's only these mycotoxins and VOCs and other things that affect us, and thus really the focus should be more on detoxification and avoidance of exposure. So from your perspective, do mold spores potentially colonize in our sinuses, in our gut, in our internal biofilms? And is it potentially appropriate to consider antifungal therapies? And where I'm kind of going with this is people will be in an environment maybe for years that they know had a mold issue. They're in an environment now that they say is completely clean, but maybe aren't recognizing that if they were colonized, they have an internal factory that's producing mycotoxins, even if their external environment is perfect. So is that concept of colonization? What are your thoughts on that?
I think the colonization concept came up from a few studies that were done occupationally, where there would be hundreds of people exposed to a moldy building at work. They remediate the building, they get everybody out, remediate the building, bring them back in, and about 30% of those people aren't better. They're still exhibiting symptoms. And those symptoms could be respiratory, but they could also be fatigue, neuropathy, that kind of immune deficiency, frequency of colds, that kind of thing. So then we start thinking, and in our own patient populations, we're seeing this as well, where we went ahead and got them out of the environment, but they didn't get better. So what's going on there? And I think that where I stand today, and I want to tell everybody my opinion might change, but my understanding of what happens is that when we are exposed to the gases of a sick building, remember a sick building is hosting all kinds of critters, but specifically mold that has found a nice place to live and is gas bombing everybody around to establish its territory. I feel like what happens if you were to test normal sinus, and for people who have no symptoms and would categorize themselves as normal, controls. Everybody has fungus in their sinuses. Everybody has bacteria in their sinuses. Staph, we have a lot of Marcon's conversation in this world. We all have them in there, but only the sick people are they making mycotoxins. And so I think that being in the environment where there is competition being sent out into the environment via gas messaging, then our own intrinsic bugs go, uh-oh, I'm under threat. I better start behaving badly too. So it's almost like what I think about is the biofilm intel from the building moves into the intel of our body, and it tells it how to survive on top of our system and not act symbiotically anymore. That's the way I think about it.
Essentially kind of quorum sensing from our external to our internal environment.
That's right. Yeah, because of course we are. We're in the, we don't even know the vibes we might be exposed to. We're only testing things, well, we kind of do with the EMFs, but we're testing things that we can measure chemically. But I think that what that does is that turns on an energy, a thought process, and a behavior of our bodies and the microbes in our body to act competitively rather than cooperatively. And that's like, I know it's
getting deep now.
Yeah. I go there.
So that's
why I bring in antifungals, because I feel like then, we got to put the hammer down. We have to say, whoa, you're not acting like you're supposed to act when you live in a body. And that's been the recalcitrant cases that have been referred to me have not addressed the nasal and the gut biofilm. Perfect. And if you can get systemic antifungals on board and directed nasal treatment on board, you don't have these people that are so fragile and so sensitive that they can't even, drive by a moldy car and get whacked. I mean, I had a patient like that. She couldn't drive with her windows open and any fans on because if there was a moldy car in front of her, she would react.
Yeah. Yeah. And then I think it's important for people to realize that when you get to the place of considering antifungal therapy for colonization, you need to be out of the exposure, right? It doesn't make a lot of sense to try to clean up the internal part of the mold or fungal overgrowth when you're still getting re-exposed. So I'm assuming that your flow is similar, that colonization piece comes after they've gotten rid of the environment or remediated or whatever, started the detoxification thing, and then the antifungal piece might be layered in.
That's right. Because if you start the antifungals, two problems. I mean, first of all, it further confuses the mold in your body and the fungus in your body, the natural fungus, natural yeast. You're saying, get back into your spot. And it's like, but the message from out there is that I'm under threat. So it'll just be turned back on again. So getting out of that environment is important.
You talk about, this was new to me, you talk about toxic breath and how we can breathe out mycotoxins, potentially making people around us sick, which I had not heard before. So tell us more about how one person can breathe out mycotoxins and potentially make someone else nearby sick.
Yeah. And I learned this the hard way through intimate partners where a partner and mother and breastfeeding child. So the sick person that had been exposed to the water damage building got out of the water damage building, and their exposure was years prior. Still hosting bad guy biofilm in their body, still having colonization is what we're calling it. Then that colonization is mycotoxin producing and endotoxin producing every time you inhale. That's how we get it, also through the capillaries and the sinuses. And then when you exhale, you're exhaling out those mycotoxins. So if you think about a nursing mom who has, those biofilms and looking down at the baby was covered with eczema, and we couldn't get on top of it. And in the appointments, of course, moms always come for the babies and not for themselves. I'm hearing sinusy voice, and I'm thinking, well, that's pregnancy, and and then we start to investigate, and here mom had sinus colonies going on, gut colonies, and all of it was sort of masked by that pregnancy protein or pregnancy hormone situation. And the longer breastfeeding went on and baby was sick, and the more we investigated, it turned out mom was making baby sick with mycotoxins through breast milk, because mycotoxins do get passed through breast milk and through her breath. And then I had a couple cases of intimate partners where we tested, the partner was negative mycotoxin testing, natural killer cell function was holding okay, but they had tons of toxicity problems, tons of new onset, all the stuff we talk about, new EMF exposure, chemical sensitivities, new food sensitivities since being in this relationship. And the way that I finally came to understand it was, well, of course, if we if we have mycotoxins being formed in our sinuses, those are gaseous chemicals. They're slimy and gooey, but they could come out through the breath. So of course that could be making a difference. We started treating the sick partner, and the chemical sensitivities, EMF sensitivity of the intimate partner get better.
Yeah, this is cool. That's another concept that I had not heard talked about before, but especially for those people that are very, very sensitive, could it be that someone else in their household that maybe doesn't manifest symptoms because their body is wired differently, can maybe detoxify better or whatnot, but they could actually be the source or trigger for the person that is symptomatic just from what you're talking about here?
Yeah, I think so.
Interesting.
Yeah, treat the whole.
You say that mold will not go down without a fight. When molds are threatened, they put out more mycotoxins as a defense mechanism. So tell us a bit about why we should not attempt to clean up a moldy environment on our own, that we should really leave that to the pros. And unfortunately, I've had people that I've worked with that tore down their own walls and all kinds of things and really made themselves much sicker. And then on that point, do things like ozone or even essential oil diffusing, does that potentially threaten the molds in such a way that they then produce more mycotoxins?
Great question. Yeah, so dying mold, and we've seen this in studies, mold as it dies, it will actually increase, and that's mold exposed to amphotericin B, will increase its amount of mycotoxin exposure or mycotoxin production. And that was gliotoxin in that study. So people who are pre-sensitized that are already sick from mold have absolutely no business doing their own remediation. The people that are the professionals, they're not only wearing all the gear and masking, but they're also obviously not a genetic canary to mold sensitivity, or they wouldn't be doing this kind of work. I do worry about those guys. I always nag them about taking milk thistle and quercetin and things that you can preload with that protect your liver, because the mask that they have does not clear mycotoxins. So they're still getting the toxins in. But, if you're already sensitized, you already have a gummed up detoxification system. Your liver and your kidneys are challenged. Your immune system is challenged. We talk about that epigenetic milieu is getting gummed up. The ECM. I mean, there's too much load already on the system because you're having symptoms. So why go into an environment that's making you sick and increase? And I think it was by 4 times, I can't remember off the top of my head, but so a 400% increase in those toxin levels, that just doesn't sound like a good idea. The whole idea is, like you talk about, reduce the amount of junk coming in while you work on getting that stuff out.
So ozone and essential oils then, good idea, bad idea?
So essential oils have been studied that they neutralize mycotoxins. And I have a list in my book of those that I like, such as, all of the ones you would think, the antifungals, the clove, the eucalyptus, oregano, ajoine, which is like a basil oregano combination. Those have been shown in studies. Oh, and thyme, can't forget my favorite, thyme. They've been shown in studies to neutralize those mycotoxins, and they are mold static and some are mold cytal. So that I love essential oils for that purpose. The negative of essential oils is they do have high aldehydes. So some of our mold sick patients that are really liver, SNP rich, so to speak, can't really tolerate those essential oils. So then we can turn to ozone, which does neutralize somewhat those mycotoxins, also endotoxins from bacteria, and they're cytal and static on the bacteria and molds. So those are nice combinations, neither of which replace remediation. You have to get the sick stuff out.
And just for people listening, I think the reference to ECM, I think you were talking about extracellular matrix in the earlier conversation.
Yeah, the ground substance, all the water in our fishbowl, so to speak.
The sponge that collects all the wonderful toxins in our body.
Yeah.
You say that mold turns us into a wimp. So tell us about how it weakens or dysregulates our immune system, which then opens the door for other chronic infections and activation of opportunistic or dormant or latent infections that maybe we've carried for a long time. Do you think that it's possible for someone to have Lyme and co-infections and be essentially asymptomatic, but then get a mold exposure that leads to immune dysregulation that then allows those pathogens to start creating symptoms?
Yeah, I absolutely do, because I saw it in my practice. People that were coexisting with Lyme and co-infections, and then moved into a moldy house or had an exposure through a car in one situation where critters moved into the car and grew mold, and occupational exposures. The way that mold turns you into a WIMP, I'm talking about immunologically when I talk about that. It lowers your innate immune system. So we have our innate and our adaptive immune system. First and foremost, it goes to the innate. And we have a lot of, I think of the innate system as Rambo, the one-on-one, hand-to-hand combat. And then the adaptive is like the British Army, very organized. And so we have a lot of soldiers on the ground in our body normally. And when 1 or 2 or 100 get picked off, you don't necessarily notice it. So it can be, there are other ones that can take over. And I think that's the real sneaky piece. That's when you start to see natural killer cell function reduce, but not necessarily count. Because then the guy wires to the British Army or the organize and say, we need more soldiers on the ground. And so the body sends more. Over time, you will see a deficiency in natural killer cell count. But first you'll see it in function, just because it starts to affect on that one-on-one, hand-to-hand combat side. That's going to be the chronic viruses. That's going to be the cancers that don't get cleaned up when they're made. Mold is very carcinogenic. That's going to be teratogenicity because of, again, the milieu that baby is being formed in. So, and maybe some food sensitivities, just little things that are going to be more the cytotoxic reaction, so the lymphocytic reaction to foods. So you do a food allergy test and you don't necessarily see anything, but they're still reacting to certain foods. That's that early exposure to mold, early wimpiness. So with this, you'll see somebody get sick more often, or when they do get sick, it just kind of drones on and on and on. They can never kick it. And then there's the adaptive immune, over time exposed to that mycotoxin. Then you start to see T and B cell deficiencies. And you can mold actually imposes an immune deficiency state. And it's just from exposure, not genetic.
And in talking about natural killer cell function reducing, another way to interpret that is that there's a shift from Th1 to Th2, that we become more allergic, more inflamed, and that we have less immune surveillance for the pathogens that are intracellular.
Very well put. Absolutely.
Okay.
Yeah.
Perfect.
Yeah.
We know that candida leads to carb and sugar cravings. You say the same is true of mold. So what's the connection between water damage, building exposure, molds, sugar cravings, and how that then kind of keeps the cycle going by feeding some of these pathogens or molds within us?
Yeah. So if you've been exposed to water damage building, you would get the biofilm intel into your body. You get colonization. And through colonization of that biofilm is a very ill health area. So you'll have candida and you'll have other normally existing fungi that are now behaving badly. And it sort of acts like a cancer in your body. It wants to be fed first. And mold, yeast, everything, their favorite food is carbohydrate. So when you start to see somebody who kind of needs their carbs, or they will get a detox reaction, I know they have candida, and I know that there's something going on fungally. It could be just diet. It could be their lifestyle. It could be their hormones are off. We see that a lot as women go through menopause, or we see that in teens as they're going through puberty. Could be those things. But if it's something where we do all the normal stuff for candida and it doesn't go away, then I start thinking about water damage building exposure.
You say that mold leads us to being crazy, hazy, and lazy, brain fog being a common complaint that people may have with mold illness. So talk to us a little bit about how we feel like we're literally walking around with this brain fog all the time.
Yeah, so if you think about the mycotoxins are very similar to alcohol. So if you've ever imbibed too much alcohol, that's about what you feel like when you've had a mold exposure. You just kind of, things are a little fuzzy. The cognitive thing is a big problem for mold exposure. We can link that to the mycotoxins. You can link that to spore exposure too. Lots of people describe that they just can't get their head together, and it's because they're being poisoned by alcoholic substances. And that is also what's going on with that hazy thing is visual. When you have had too much to drink, your eyes don't necessarily work together. They kind of, one may work a little faster than the other, and you don't have convergence. And there's also a delay. So that's one of the things that mold will do, is it'll put a delay in your cognitive thinking. It puts a delay in your visual processing systems and a delay in neurofeedback. So we'll see people get lazy because they don't have the urge anymore to get up and move. If you've ever had a glass of wine after lunch on a Sunday, you know what that feels like.
I love your term biofilm intel. That's a new one.
Yeah.
That's good. So mold allergy, you say mold can cause allergies. My understanding is that mold allergy is different from mold biotoxin illness, that you can actually have mold allergy, you can have mold biotoxin illness, you can have both of them overlapping. So
Right.
Oftentimes people will do immunoglobulin testing for different molds to see if they're reactive. That's not necessarily an indication that they have a biotoxin illness, but it is an indication that they have an allergic reaction potentially. So
Right.
Tell us a little bit about your thoughts on mold allergy testing, and then are some of the allergy or immunomodulating treatments potentially helpful for mold as well, like low-dose allergen, low-dose immunotherapy, sublingual immunotherapy, homeopathy? How does that mold allergy piece fit in here?
Yeah, so you're absolutely right. They're not mutually exclusive. I have people who will bring me a mold allergy test. I'm in an unlicensed state, so there are those that don't know naturopathic doctors. Some are in states that are pre-licensed. So I don't order a lot of labs unless it's going to be covered by the person's insurance. So when we have an insurance covered situation, I'll run those just so that we have the information, so that I can tell somebody, okay, I actually see the people that are mold allergic tend to be healthier because they get a reaction and they get it quickly and they get out of the environment. It's the people that are not mold allergic that I worry about, because they can write off some of these symptoms of, I feel a little fatigued and my ears are ringing and, I can't get my head to work right, but they're not having an allergic type reaction. So they stay in the environment. So the immune modulators are absolutely key. I think that I start with physical ones, so more like plant medicine and foods and that kind of thing, because the homeopathy and the slit therapy and things, you have to have the person to a certain level of robustness of their immune system. Otherwise, what I've witnessed with that is that they become sensitive to everything. Like, they're no longer sensitive to mold, but now they're sensitive to everything. So I try to get them to a level where I feel like they have enough of a robust immune reaction and it's acting more normal. So they might get a cold and it doesn't take 3 weeks for us to notice it's a cold. I don't know if you've ever seen that, but someone gets exposed to a cold and finally 3 weeks later we're like, oh, you're having a cold, because they don't get a fever and they don't have a robust enough immune system. That is not the time to be telling the body, okay, we want to desensitize you to that exposure, because they don't even have the energy to have a normal reaction to something. So that's where I'll use aloe and larch and astragalus and things like that to try to boost up their system. Vitamin A, vitamin D, a lot of the things that we use for immune modulation.
Yeah, there certainly are those people that will say, oh, I haven't had a cold or flu in, a decade. And then as they are recovering, they have a whole series of them, almost like the body's playing catch up, right?
Yeah.
But in a way, it's at least a sign that their immune system is starting to be able to get back in the game.
Right. And in practice, I always warn my patients about that, okay, we're going to see the onion peel, and I'm going to make my bets on the first thing that's going to come up and then the second thing. And I want you to call me and tell me if I was right. So it becomes a game. You can kind of gamify this bad reaction. And my staff has always said that. They're like, I've never experienced people calling and saying, she was right, I got the rash, and be excited, because
Right.
We've already prepped them with that expectation, then it's not scary.
How does mold and mycotoxin exposure lead to food sensitivities, to chemical sensitivities, or multiple chemical sensitivities? What is that cycle there?
Yeah. So mycotoxins, a known thing that they do is they winnow away or erode the lining of our mucous membranes. So you get that with sinuses, which makes us really worried about brain stuff. But also from the esophagus down, you can get ulcerations and inflammation. So you can see anything from esophageal eosinophilic esophagitis to gastritis to duodenal ulcers. And you can get Crohn's type ulcers all the way through the intestine. So you get this blunting of the intestinal epithelium. That then creates, and the inflammation creates the leaky gut situation, which then allows more proteins through the blood system, and then you become reactive to whatever you're eating frequently.
Yeah, one of my mentors, Dr. Ann Corson, she says something to the effect that it's like the mold toxins coming into the body are like throwing sparks on a silk scarf, essentially. So, something like that. It's some variation of that, but it gives you the visual. So, and then how do we potentially become more electromagnetically hypersensitive when we have mold exposure?
So that's another piece, and Dr. Klingart speaks about this, that it's not only the way we're building our buildings, but we're also infusing those buildings with this higher electromagnetic frequency exposure, and the mold doesn't like that either. So it kicks up its exposure or its production of mycotoxins. And they've actually shown that, and I think Dr. Klingart is who has done the studies on this. So now you have a known spore exposure, a mycotoxin exposure, a chemical exposure with aldehydes, alcohols, VOCs, another chemical metabolite, mycophenolic acid, and things like that challenge the liver. And now we've added the energetic piece, which is the EMFs. And so you have somebody who's now in an EMF-rich environment that's made even richer by being in a moldy environment, and that self-fulfilling cycle. And so we're electrical beings. We naturally make EMFs. When we exercise, there are good EMFs that we make. So that's why you see a lot of people become exercise intolerant when they've been exposed to a moldy building, because their EMF load is too high to even add any by movement. Isn't that nuts? And for me, I really am a proponent of managing that EMF, and I work with a healer who harmonizes the body to harmonize with the EMF, so it doesn't have to become something so toxic. So I think of it sort of like the slit therapy and the immunomodulating therapy. You have to get them to a certain level of vitality, and to do that, I get everybody outside. I don't care how sick you are. Let's roll you out on the bed or the wheelchair. You have to get outside, and you have to get with nature. Two things that does is obviously EMF grounding, earthing, but also being with trees and the appreciation of trees increases natural killer cell function and count. And that's where mold hits you specifically. So
and sunlight exposure, vitamin D, immunity, inflammation, all of those things. Yeah, no, that's a great recommendation.
And clean air. So if you are in your environment and you were too attached to your things and you brought things that have mycotoxin and mold, getting outside gives you a break from that as well. And you get your clear head enough to figure out how to manage that.
You've said that mold sickness is hard to identify. So why is it so difficult to diagnose, and what are some of the bigger clues as a clinician? You shared a couple of them already, but I want you to share with our listeners a little about the Crista mold questionnaire and how you then decided what symptoms go into different categories, and I believe there were 3 different categories, what the different categories mean as part of that questionnaire.
Yeah, great. So it's often misdiagnosed because it's a lot like Lyme disease, in that it can affect every system in the body and cause almost any symptom, because it's multisystemic, multisymptomatic, as Dr. Shoemaker teaches. That can mean that how I get sick from mold is completely different from how you will get sick from mold, which is completely different from how even my children, who are genetically like me, they're going to get sick differently because they aren't exactly like me. They're genetically like me, but they've had different exposures and different biography for their lifetime. So it makes it very hard to figure out whether it's Lyme or mold or heavy metals or something else. And that's one thing I learned from Dr. Horowitz, is that Lyme has a distinct characteristic of migratory. So you don't see that with mold necessarily. I haven't seen it actually with my just straight mold patients. I don't see the migration. I see symptoms change, but I don't see that, I had joint pain in my left knee and then it went to my right knee and now I have it in my first digit on my finger. That's the same symptom moving around the body. So very commonly we will see things that are neurologic and like toxic. So neurotoxic like symptoms. And also we'll see a lot of mast cell type symptoms. So the whole mast cell activation syndrome, there's a big crossover between mold exposure and that. And then MS, Alzheimer's. Dr. Bredesen talks about inhalational Alzheimer's. Because of that, I love that silk scarf. Dr. Corson is amazing. So, if you have that going on in your sinuses, then you can get those toxins right up into the brain. And they've actually showed that those toxins migrate through the nasal nerve. It'll make it into the cerebellum and the frontal lobe. And I've actually had a patient with melanoma, which I also think is connected to mold. He had a brain mets, and it went exactly to those two places in his brain. The practitioners that are listening, please know that I think of this as a living document. I want feedback. I want to make this a tool for all of us to use, because that's why I developed the questionnaire. When I was seeing a lot of Lyme patients, heavy metal toxicity patients, glyphosate toxicity, I see a lot of environmental illness. I needed a tool for myself to see how many arrows were pointing toward mold and how many were not, so that we knew whether we had to, because if it is mold, then you have to get into someone's home or their work, or, it gets a tender topic because it involves then bigger things. Then it's already hard enough to change your diet. So the categories I did were, category 1 is really common general symptoms that are tied to mold, but not necessarily pointing more arrows toward it. So it gets a lower score if you have a lot of those things. The second category is things that are a little more severe, manifestations of the category 1 things that are pointing more arrows toward mold. And the third category of things that are very high risk, cancer, MCAS, POTS, dysautonomia, those sort of things, Alzheimer's, dementia, tics, tremors, those things that are associated with mold and mold toxicity that are very serious. And so they get a higher weight if you have more of those. And so I would love, though, feedback. When you publish a book, you have to press print eventually at one point. So I just put it out there as how it is. But I'm hoping that with feedback and with everybody using it, we can refine this to make it a really usable tool. And I use it to track treatment progress as well.
So tell us about the scandalous cover-up. What is it about mold that is a scandal? And is it a financial scandal or something else?
Absolutely financial. Yeah, there have been labs that are working on making mycotoxin antibody tests for us to be able to run as clinicians that have been shut down. There are a lot of people out there that have a strong interest in not having the word about mold, mycotoxin illness to get out. Because remember, as a Navy SEAL, mold can exist behind the walls, under the flooring, in your ceiling, undetected. You're still getting sick from the mycotoxins. Whether you can see mold or not, mycotoxins make it through building material. But if we uncover it or it's visible, it gets addressed. But if it's invisible, like the real estate world, where they go into a house and just clean up the mold really quick with bleach, those kind of things, then it's there are a lot of people interested in keeping that a cover up, and us as well. We don't want to tell a patient this is going to be really difficult. You have to leave your things. And so we also play a game with ourselves of covering it up, like, no, it's fine. It's not as big of a problem as I thought. And that's what I did even personally. And that's why finally I was like, I need to write this book, because I did it to myself and I even know what I'm doing,
Yeah.
But,
and I really do urge people to get this book. I mean, we are going into a lot of detail here, but nothing compared to what's in the book. I mean, I've read the whole book, so much good information in there. It's a fantastic resource. It's available on Amazon and lots of other places. So hopefully after you listen to this, if you're dealing with mold or want to explore that possibility more, do get the book, because it goes into so much great information. And one of the things I really liked about the book is a lot of the things that we'll get into in a few minutes about potential therapies and therapeutic interventions. You really outline step by step, like, this is how you implement, this is how you do it. So I loved it, actually. It's just phenomenal.
Thank you. Thank you very much. That means a lot coming from you. You're a smart guy.
So talk to us about common mycotoxins that we might encounter, which molds are more likely to be the creators of those mycotoxins, and then what are some of the issues that mycotoxins actually create in the body, or what systems are they primarily affecting?
Sure. The ones that get all the press is black mold, which is Stachybotrys, and it makes trichothecenes, which is a whole family of very toxic, very carcinogenic mycotoxins. The one that doesn't get as much press is chaetomium, or chaetomium, depending on where you are in the world. chetoglobicin, which is its mycotoxin, is very toxic. It's on the level of trichothecenes, and it can actually cross the blood-brain barrier. So that one is a pink mold, and it can grow even on concrete. That one is, for me, a very big, it's a big one that I watch for and try to counsel patients on, and they say, oh, it can't grow downstairs because our basement is unfinished. Good to have an unfinished basement, but if you're not managing humidity, that's where Chaetomium can come in. The fact that it can cross blood-brain barrier has me very concerned. So that one I work hard to make sure we get out of the environment and out of the body.
And which mycotoxin is that one producing?
That's chetoglobicin.
Oh,
it's
that's okay.
CHAET. So I don't even know if I'm saying it correctly, but that
sounds good.
Right. Okay. I can type it. And then because they're more common, they don't get as much press, which is penicillium and aspergillus, which is, just because they're common doesn't mean it's a good thing. And they make aflatoxin and ochratoxin, which are both very toxic, not as toxic maybe as the trichothecenes, but if they're more commonly found in internal environments, so we're getting more of a load of that toxin, that puts it at the same weight in my mind as the trichothecenes. So, and then gliotoxin, which is made from a couple of different, so we've got fusarium is found in HVAC systems that also spits out some trichothecenes, and fusotoxin or something like that. So that one is one of those insidious ones where it'll look like a lot like gliotoxin, where it can cause more fatigue and immune problems, brain working, that kind of thing. And then people can't recognize that they're mold sick. Gliotoxin is also formed by candida. So when you do get a positive gliotoxin on a test, if you do mycotoxin testing, then you have to kind of step back and say, okay, how bad is this person's lifestyle? Is it really from being a carb craver that we need to get the candida under control? So that doesn't necessarily mean if gliotoxin is your only positive mycotoxin, that might just be an intrinsic problem to take care of.
Lots of good information there. So while we're talking about mycotoxins, what are your thoughts on urinary mycotoxin testing, real-time labs, Great Plains, lots of people starting to use those, some debate that's still ongoing.
Yeah.
Are you finding those clinically helpful in managing your patients?
I personally am. I don't use them as a single test. So I will run immune testing, liver function tests. Obviously, we're looking at the patient. I will check to see if there's an anemia, because mold can also cause iron deficiency anemia, or someone who is just continuously low ferritin and we just can't get their number up. That could be mold for sure. Also SNPs, but so you're taking that whole picture. Look at it at the urine mycotoxin. Now that we're able to do a direct mass spectrometry test, that then you're catching the pre and the post metabolites, so you have a bigger window of those mycotoxins, and I found that to be a really useful test. I did learn the hard way though, if you do glutathione preloading with that, you can mask the mycotoxins. So now I don't do any preloading. I want the person to do their normal routine and do a first morning urine and then get the look. And why I found it useful is that I've seen that as mycotoxins reduce, symptoms reduce. But in those times where it's an intimate partner, they may have all the symptoms of mold toxicity, but not have urine mycotoxins. And that's when you go looking around for a bigger picture.
So some practitioners might suggest that taking liposomal glutathione to start dumping mycotoxins from the cells could potentially increase what you would find in those urine mycotoxin testing. What you're suggesting is, in some cases, taking glutathione might actually make it look like there isn't a problem when there actually is, that it may lower what you're seeing captured on the urine mycotoxin test. Did I understand correctly?
Yeah.
Okay.
And I think that depends on the technique of the mycotoxin test that you're using.
Okay.
So the one that I use is the mass spectrometry, and it is a direct test. So it's being detected in the urine and a little bit of the pre, but mostly post metabolites as well. So that spectrum that you're getting, we don't want to have the body metabolize that into a different chemical. Mm-hmm. And then we're not catching how big of a load we're dealing with.
Excellent.
And I don't ever look at that as a solo test. I'm looking at it in a bigger picture. Stool testing often, because SIBO can be caused by mold toxins. So, we want to see the whole picture. If we know there's a mold exposure, I may even save the money on the testing. We just get going. We just get going on treatment, use the money on that.
When a patient has to leave their environment, what guidance do you give them in terms of what they can take versus what they should leave behind, things they potentially can clean? I know this is probably the question that I hear most from people. What about my car? Those types of questions. What do you recommend?
I think this is always a frustrating answer for patients because I'm saying, well, it depends. There's no one thing that's going to work for everybody with every situation, but primarily you need to leave your things behind, get well, take only the most necessary things and things that can be washed on hot and dried on hot with essential oils added to the laundry. Some of those things we're able to move into the new environment and have no problem with. I personally, because I've been working with patients and doing pre and post testing of remediated things, one of these days I will get that all written down and show what we've found. But I found that things that are more real wood and real leather and things that have natural oils on the inside that can protect them from invasion tend to do better and can be remediated and brought with. Things that tend to be more broken down, that would be textiles, that would be wood kind of products, things that are made with OSB and plywood and that kind of thing tend to not be able to be remediated and need to be destroyed. I had a patient who they had antique furniture from their, heritage that all the upholstery was taken off. We remediated the wood and it was real wood. It was mahogany. It's like that's got some real resins in there. Remediated it by sanding, treating with essential oils, sanding again, treating with essential oils, did an ozone bath. Then it tested fine afterwards. So they were able to reupholster and have that furniture. But, that's a real attachment thing. Like it would have been so much more cost effective to just get new furniture.
Right.
Yeah. So leather I've seen do kind of okay. And that surprised me because I thought that it would be really soak in those mycotoxins. But I think that if it's leather that's been conditioned and worked with, not just let dry, it tends to do okay, leather furniture. But overall, I've seen people have to lose more than they desired. And that's unfortunate.
And what if people are reactive to their car? Do you find tools that make them still able to be in that car, or do you recommend that they get rid of it?
That's the thing is a lot of people then the stuff that they take with them, they put in their car and then it infects the car. I have in our area, we have a place that will ozone your car. They do shampooing with, I have a shampoo that I use with ammonia, vinegar, trying to think of, and a little bit of dish soap and then essential oils. And the car place will use that instead of any kind of perfume or chemical. And then they'll ozone it afterwards. And we've seen that be successful in a majority of the cases. Yeah.
Excellent. So when we talk about environmental testing for home, work, school, car, what do you recommend for patients? Do you do an ERMI? Do you look at the Hurts Me Too? Do you like any of the plate testing like immunolytics, for example? Obviously, for many people, it's important to bring an indoor environmental professional in and really do a deep dive. But if you're still at that kind of screening place, what tools do you find helpful?
So we are doctors. We're good at bodies. I'm not good at buildings. So I'm going to just preface it with that. The people that I work with, the building inspectors that I work with are amazing diagnosticians for buildings. They can find it. If it's there, if the person is sick, they can find it. But it often involves spore trap analysis where you're actually digging into a cavity, sucking out the air and trying to trap those spores for evidence of that material. I personally have had better results sending in bulk samples. So when we're in an environment, if we can dig into a cavity, then I try to scrape some of the inside of that cavity and send that material, whether it's the bottom of a sill plate or the back of drywall or whatever, and send that in. And I'm getting a little stronger, truer testing even than the spore trap. But the person that I work with a lot, she will use spore trap analysis. There's also the EMA testing where we do, the ERMI, which ERMI is a little, it's not going to be your solid test, I guess. When you add in the evidence of mycotoxins, that has been a really nice one that people can work with one of those consultants, a building inspector, virtually. They can send them the kit and tell them how to collect the dust for mycotoxins. And that has been a really nice do-it-yourself sort of test with guidance of somebody that knows how to find the dust. So they get into their HVAC system if they have forced air heat, or they take dust samples from everywhere except by windows and doors. So tops of picture frames, tops of shelves. I have found just doing a solo mycotoxin test has been really informative pre-purchase. To make sure that somebody is not going into a moldy environment. The problem with mycotoxin dust testing is it doesn't tell you if it's a current or a forensic problem. So it could have been an old problem. The building is remediated, but there's still mycotoxins. But for somebody who's already sick from mold, that's not an environment they should be spending any time. Right. But it is a nice way to kind of test your own remediation to see how are we doing. Is the level going down? If it's not, boy, we've got to work on our air filtration and question whether the remediation was thorough.
So the ERMI is looking at a dust sample for the actual molds. The EMA that you mentioned is looking at a dust sample for the mycotoxins or the toxic products that these molds are creating. I think that's also available from real-time labs, correct?
Mm-hmm. Yeah. Yep. And the EMA is a combination. It's mycotoxin and spore, if I'm understanding.
Okay. Beautiful. Excellent.
Yeah. So you get a better sort of trying to look at a bigger picture.
So the last half of the book, you talk about different tools, you talk about avoidance, you talk about fundamentals, protecting, repairing, and fighting. And so we're not going to have enough time to go into each of these in great detail, but I wanted to just kind of give people a sense for what you're discussing so that they can then go out and dig into it deeper in the book. So in the avoidance realm, what are some of the steps that we need to take to avoid mold and mycotoxin exposure? And then how often do you find your patients can successfully remediate versus you ultimately suggesting that they need to move to a new environment?
So in the avoidance realm, this is the cool thing about this is it's the total empowerment realm. That this is someone has complete control over. It also tends to be where we have complete attachment. So it's not only getting out of the moldy environment, but also addressing and looking at what other habits, hobbies, foods, beverages, supplements, medications, things that may be increasing your fungal load or your mycotoxin load. So that's the whole, looking at avoidance is also looking at, are you a brewmaster? And did you like doing that before you were mold sick, or did it happen afterwards? And, are you addicted to kombucha and you're drinking it because everybody says it's a healthy beverage, but it doesn't make you feel good, but you don't listen to yourself because you're mold toxic. And then, that's actually making your situation worse temporarily. It is a really healthy beverage for a healthy person to maintain a good micro and mycobiome. But if you're already mold sick, no. There are some supplements that are grown on aspergillus. They're activated. The way you can tell is obviously calling the company. It should say it on the label. But also if it has micro doses of things. So you would normally see calcium 600 milligrams and it says calcium 30 milligrams. That means what they're putting in is bioactivated calcium that's been processed with or fermented and more bioavailable. Fantastic supplements unless you're mold sick. And so that's
enzymes too, right? Or another one that are very commonly aspergillus derived.
Mm-hmm. B vitamins. Yeah, a lot of my mold sick patients can't tolerate B vitamins. They have to have them with food. They make them feel sleepy. And you're like, wait, B vitamins just give you energy. That's the connection. It was a mold problem.
Excellent. Yeah. Let's talk a little bit about dust. So I had not realized that dust really is kind of a food for mold. I've heard people, John Banta and others, say it's really important to do a deep cleaning of your environment to minimize, the potential for creating an environment that's going to allow mold to grow. So why is really avoiding and cleaning up dust so important when we're thinking about mold?
Yeah, that's another empowerment thing. It's good exercise to go through your house in dust, but dust is a already digested carbohydrate. So the fact that it can be airborne means it's already broken down. You wouldn't see a mahogany dresser flying through the air and landing on top of one of your books or picture frames. It's too dense, and it's a complete unit. Whereas dust are these little particles that come off of fleece, off of textiles, of course, dirt, and the dirt has spores already in it. So now you've got this combination. All you need to add is a little hidden moisture source, aka humidity above 50% in your indoor environment, and you've got it all dialed in. You've got a dark environment. Usually these are areas that aren't really seen by light. You've got stagnation because the dust is now settled, and you've got its favorite food, and you add a little water, and you've just became a mold farmer.
Yeah, I have some dusting to do after this, I think.
Yeah, when I had pre-readers reading the book, when they got to that section that dust feeds mold, they're like, I put down the book and I had to go dust my house. I'm like, yes, okay, that's exactly what I wanted to do.
Many with Lyme disease are using several different antibiotics. What's the connection between antibiotics and mycotoxins, and why might this be a concern for people dealing with mold illness?
Yeah. So if we think about how penicillin was discovered, it was the moldy bread, and there was little mold in the middle, and then there was this clearing area where there were no bacteria in that clearing around the mold. And what that clearing represents is in a ring of mycotoxin. So you're basically, when you're taking penicillin, you're taking mycotoxin of penicillium. So that's really hard on somebody who has Lyme and mold. That's going to be your Lyme patient who can't tolerate antibiotics. They have counterintuitive reactions. That's a little clue for those of us who treat Lyme or that are dealing with Lyme. If you're not tolerating those antibiotics, you may need to clean up the mold issue first, or concurrently work on using botanicals that are going to have some of those antimicrobial actions by lifting the immune system, and then stay off the antibiotics until you can tolerate them. Some people just need the antibiotics. Not all antibiotics are mycotoxins, though. So that's where we might switch into different types of antibiotics to treat the Lyme and knock down the bacterial load so they can get well enough to immune modulate. So that's the art.
The next piece of this is the fundamentals. That's the next group that you have in the book. So that's things like sleep, detoxification, and what you call the health hokey pokey.
Yeah.
So I want to talk a little bit about detox. So you term it emunctories in the book. This is a topic that I really get excited about. For me, detox is number one. We have to open the routes of elimination to support detoxification and drainage. We have to think about the liver, the kidneys, the lymph system. You've already mentioned the extracellular matrix, so critical. So I think health really is very closely tied to getting more toxins out of the body every day than we take in or produce. And I'm interested in your thoughts on some of the interventions that you recommend to your patients in support of kind of opening up those emunctories and supporting detoxification.
Yeah. So emunctories work best if you're following a circadian rhythm. We all have a biological clock, where we have chronobiology is this new science, which is an old science that's now being rediscovered, that says that certain things like to happen at certain times a day. And a lot of my mold patients turn into vampires. They can't sleep, and so they're up all night, and then they're sleepy all day. And the first thing that we work on is try to get them on a regular human cycle. You know, owls are up at night, humans are up during the day. So getting on the circadian rhythm, trying to eat at regular times, trying to exercise or move at regular times, hydrating at regular times, something where you're putting the body on a real discrete schedule, because with brain fog, you can lose the time of day and not even realize you haven't eaten and that kind of thing. And then the health hokey pokey is that whole thing of just trying to get people on a circadian rhythm so their emunctories can work best. If you're not on a good circadian rhythm, you're working against those emunctories. If you're eating when your liver is trying to spit out the toxins, and your gut is trying to evacuate, and you're eating during that time, that can be really confusing for the body, and you're working against your emunctories. So I first start with circadian rhythm, but then I also love mud baths. I think taking baths in dirty water or hanging out in mud, those are incredible. Using peat therapy or peloid therapy, which is a way of getting microbes and a microbiome on the skin level And there's a nutrient exchange and a heat exchange and things that happen with that peat therapy that just cleans up all of that goop that's out in the microcirculation. These people are major claudication. They have hypercoagulability like crazy. So using peat, that's just such a nice way to move out the gunk and move in some nutrients and microbiome into the skin.
That was another new thing I learned in the book was peloid therapy. I hadn't heard that term before, so very cool. Water and hydration ties into this emunctories conversation as well. So some have said the solution to pollution is dilution, but in people with mold illness, we can drink a ton, we can pee it all out, we can still be dehydrated. So how do we address that whole antidiuretic hormone issue that might lead us to still being dehydrated?
Yeah. So you had asked me earlier, and I forgot to answer, how do mycotoxins impact the body? All mycotoxins deplete glutathione in the cell. All mycotoxins tire out the antioxidant properties in the cell. So we're talking at the cellular level. All mycotoxins impact mitochondrial function and can cause mitochondrial damage. And all of those chemicals work in a water matrix. So the other thing that mycotoxins do is they change your body's receptivity to ADH or antidiuretic hormone. So now the brain doesn't know to secrete this hormone to tell the kidneys to hold on to more water. And I think that is part of the mold's Jedi mind trick that it does, because the more dehydrated you are, the more mitochondrial damage, glutathione deficiency, and oxidation can happen at the cellular level. So there are certain waters that help keep the person hydrated, and a lot of these people need salt in their water, but I start with spring water. Using something that's been hyperfiltrated actually doesn't have enough solutes now as somebody that has ADH deficiency and glutathione deficiency and mitochondrial damage. You need all those little minerals that make the electrical system work and make those solutes move into the cell. So I use spring water. And I have my favorites, but often if you can find something from where you live, it's going to also have information. Here I go deep again. Information about the land that you live in that offers more information as well for you, more grounding.
Excellent. Beautiful. So let's now talk about protect, which is the third of these groups that you talk about in the last half of the book. So you talk about protecting the brain, the nervous system, the immune system, the gut, all of the emunctories, so many different things, and then using tools like binders and bile movers, the peloid therapy that we just talked about, and then nutrients like DHA, quercetin, milk thistle, turmeric. So talk to us a little bit about some of your favorite tools here, and particularly I think people are interested in your thoughts on binders. What are some of your favorite binders? Do you find that cholestyramine is the only thing that works? Is it a combination of natural and pharmaceutical binders? What seems to work best?
Yeah, the binders, you can't have a mold discussion without having a binders discussion. So if you're not addressing the fungal load, binders become way more important. But if you are addressing the fungal load and you're protecting with some of those other things like the DHA, milk thistle, turmeric, those things make you less binder reliant. So you can have, it gives you a little more resilience to mold exposure, mold dying, killing off, that kind of thing. So these, my most important message with binders is knowing that we know that mycotoxins can kill intestinal epithelial cells and blunt them. Don't be putting somebody on a binder and constipating them, because now you've just exposed that intestinal lining to more mycotoxin and a longer duration. So my little rule is no binders if you're already bound up. So the first step, if that's the case, is I put people on cholagogues and bile movers, and sometimes even bile salts, often bile salts, to try to get more bile moving so that bile will stimulate peristalsis. A lot of these people with Lyme have gastroparesis. So we put a binder in there, and especially one as strong and constipating as cholestyramine, now we've just complexed their problem. So first stick in the bile movers and the bile salts, get things going a little toward loosey-goosey. That's where I want people to be. And then we put in the binders. And I think there's a lot of interesting conversation right now about which binder is best, which one binds which mycotoxin. That's all done out of the body. So we don't really have any in vivo studies on that. What we do know is that insoluble fiber is the key. Insoluble fiber, and we have lots of different fibers that do that. And what I see work best in practice is a combination.
Beautiful.
Sometimes I have to use cholestyramine. That's fine. That's not a failure.
Right.
Some people are just that toxic. But cholestyramine makes it really hard to do other things around it because it takes a frequency of dosing and you have to have supplements and medications away from it. And so the insoluble fibers don't have as much limitation.
And I love the conversation about the whole bile. That was something that I think I really gained more awareness over the last couple of years. Podcasts with Dr. Chris Shade, with Dr. Kelly Halderman, the importance of really getting the toxins from the liver into the bile, in the gallbladder, and into the small intestine. If you're going to bind it with binders, you have to have something there to bind. And if we're not getting toxins through that whole process, the binders can be perfect, but they may not actually be coming into contact with enough toxin to make a big difference. So you mentioned the cholagogues. I think bitters sometimes can be great. I think coffee enemas even can play a role in helping to move bile. And those personally, when I was really dealing with some of the worst times with my own health, coffee enemas were great. I would say most people that have tried them would say they were significantly helpful as well. Is that a tool that you use in practice?
Yes, and that's actually I have an online course for doctors to learn about mold, and I cover how to do that and how to guide patients. I didn't put it in the book because I've also seen a lot of mistakes done with it. So I think it's nice to have guidance on how to do it.
Absolutely.
And I've had people do them too vigorously or too soon in the process and, really deplete themselves, especially the adrenal fatigued people. So we need a little bit of, are you well enough yet to add in that coffee enema? But I love them. I'm a big fan.
And then phosphatidylcholine, right? Another huge support for kind of getting that whole flow from the liver to the biliary tree to the gallbladder and ultimately into the gut. Let's talk about repair. So repair is about mycotoxin removal, fixing damage. You talk about tools like lymphatic massage and saunas and the use of bioflavonoids, resveratrol, glutathione, alpha-lipoic acid, melatonin, CoQ10. I mean, there's so many options that you present to us in the book. I think lymphatic massage is probably an underutilized tool in the realm of Lyme disease and mold illness. Any thoughts you want to share on that?
Yeah, absolutely. And I think that part of it is that we have a wiring in our system that massage is supposed to be like this deep tissue and you're supposed to kind of cringe through it and that kind of thing. And I made that mistake. I sent a patient to lymphatic massage and he said he wanted his money back because the person that did it barely even pushed on him. And I said, well, that's kind of the point with lymphatic massage. You're just supposed to move the lymph. And he felt horrible afterwards. So we knew that he was just loaded. Again, we talk about extracellular matrix, the lymphatic channels. Mycotoxins just get stuck in all that coagulable blood, and then it just gets dumped wherever it lies. So you see skin rashes, you see ruddiness of the skin, that kind of thing. And so if I have somebody who I know is too sick to even do a sauna, and I often learn that the hard way by having them do a sauna and have them, crash afterwards and hate me and call me, or the primary area of their symptoms are skin and nervous system, then we start with lymphatic massage and just kind of see how they do. Yeah.
And to your point with sauna, I mean, one of the challenges with sauna is, yes, you sweat things out, but you're also mobilizing some of these toxins inside the body. So if you haven't done what you talked about first with the emunctories and making sure everything's really opened up, you really are potentially stirring the pot with no way for the body to then respond in an optimal manner in terms of identifying and excreting those things in the body. So I think it is something that can be great, but oftentimes, kind of like you were saying earlier with some of the other conversation, you have to get to a place that you have some stability and you have some focus on detoxification and drainage before you go there.
Yeah.
The last piece that we talk about in the book is fight. And so we've talked about avoidance, putting the fundamentals in place, adding in tools to protect and repair. Here's where you talk about things like the use of antifungals, pau d'arco, holy basil, and so on. So talk to us a little bit about what the focus is in this fight layer.
Yeah. So there are two arms of that fight layer, which is direct sinus treatment and then systemic or whole body treatment. And typically people say, why didn't you put gut stuff in? And in my mind, if I'm doing a systemic treatment, we are addressing the gut through that treatment. So that's where I will use something that's a gentle antifungal first, test the waters. So maybe a little holy basil tea, powder arco tea. If everything's going okay, they do that daily. And then I will pulse in or use in, 2 days a week. That's what pulsing. A lot of people are like, what does pulsed mean? 2 days a week, then 3 days a week, we'll do something stronger. Something like a uva ursi or thyme or something with a little more punch. If they have a real sensitive gut, we have to be real careful about using oil of oregano because it is like a balm on the gut. So I'll just kind of picking and choosing, and I tried to describe that in the book, what kind of conditions you would use these different plants for and what cautions. And then directed sinus treatment, and that's where we have, the essential oils really shine because they will neutralize the mycotoxins. So in the process of killing the mold, you're not asking that mold or the mold doesn't get a chance to feel competitive and to gas out the body, the sinuses, the esophagus, the stomach, the intestines, that kind of thing. So, and lung tissue. We haven't even talked about lungs yet.
Yeah, and holy basil, so many good things with holy basil. I did not realize that it was even potentially an antimicrobial. I know it's a superstar in the adrenal support realm, in the mast cell activation and histamine realm. So holy basil seems to be moving higher and higher on my list in terms of something that could be really helpful for lots of reasons for someone dealing with Lyme and or mold-related issues.
Yeah, that's the beauty of plant medicine. That you get all these other mechanisms of action. It makes it incredibly frustrating for researchers because you have too many mechanisms of action, too many things that you can't control for, which to me says that's a perfect tool that I want to use because I can look at the variants, things that I can impact with that one plant. And a lot of these plants also help the antifungal drugs work better. They not only potentiate their action, but they reduce resistance. So the fungus doesn't, if you have only one way, like fluconazole or diflucan, a lot of people know it as, that has one mechanism of action. Well, mold has been here longer than we have, so it's going to find a workaround. But if you use diflucan with powder arco, now you've just reduced its ability to get resistant to the drug too. So it keeps the drug as a viable alternative later in your course, or if you happen to get a urinary tract infection, you had to get put on antibiotics, and now you have a yeast infection. It's nice to have that drug available to you now if you do need a balm later.
Very good insights. Yeah, thank you. Some people will address their environment, they treat, they feel better, but they still find themselves highly reactive when they go out into the world and come into contact with mold. So what do you find that's potentially helpful to down-regulate those types of responses in people so they can reintegrate themselves into the world?
So the number one weapon you have for that is bioflavonoids. And again, those preload things that we know protect you against mycotoxins that are, if they're on board, and you can look at this in animal feed, people studying animal feed, they know what these things are because they're putting it in the animal's feed just in case, so they don't have a massive die-off. So they're putting things like DHA, quercetin, milk thistle, turmeric in feed and bioflavonoids to protect the animals from the potential that their feed will be contaminated with mycotoxins. So knowing that, that whole protect section is also to protect you proactively. Once you're better and you're going to be traveling, a great way to get another mold exposure is a hotel room. So if you know you're going to be traveling, pack a high bioflavonoid, resveratrol, quercetin, milk thistle, turmeric pack, and have some antifungals in case your body wants to say, oh my God, we're under attack again, and go into mycotoxin, intrinsic mycotoxin production. Have those things with you, but preload the bioflavonoids. I think that is a really underutilized tool for us. Good old colorful fruits and vegetables, but we have, if you can't get enough, which once you're mold sick, you almost can't, then take it as a supplement.
Yeah, no, I think that's a fantastic idea. And that also probably many of those things you mentioned supporting the mast cell and histamine side so that when we do come into contact with these things, we're keeping the immune system from being hyper reactive, right?
So, that's right.
So much good information. Guys, I really do recommend people get this book. I mean, we had 13 pages of questions to go through. We didn't get through all of them, but so much good information. I learned a ton today. Tell us a little bit about some of the other things that you're working on, the courses that you offer, how people can learn more about you and your work.
Sure. So if someone's listening and they're thinking, wow, I didn't realize all this about mold, I think I might have mold sickness, I have a little quiz on my website. They can go and take the quiz, and you get a yes or a no, that mold might be part of the problem. And then there's a whole bunch of information that I send that gives you lots of data about mold that you don't even have to buy the book. I just want people to get better. I want to spread the word about mold. So what I'm working on right now is I'm revamping my online CE course for practitioners. It's very detailed. We have a lot of information in the book, but for practitioners, we go into mechanism of action, why milk thistle is important, what specifically it's doing, how to target that plant for your patient and which to pick and choose. So I'm working on revamping that right now. And then I'm creating a workshop course for people who have been exposed to mold. Because like you said, the number one thing is, what do I do about my stuff? And I want to help people do a crisis management with the stuff piece so they can get on to the moving on with their body. And I get a lot of questions too of, okay, I read your book, but what should I be taking? And so that's why I'm trying to create the workshop that helps people work through those answers and they can get to it quicker.
Excellent. So much good information. Again, I urge people to check out the book. It's just fantastic. So it's called Break the Mold, Dr. Jill Crista. You can find it on Amazon. I appreciate all of the time that you've taken today. I know we went a little bit long. Such great information. You've been very generous. I just appreciate all the things that you're doing, all the great information that you're putting out there. And thank you so much for spending time with us today.
Thank you. Thanks for the opportunity to spread the word.
You're very welcome. Be well. To learn more about today's guest, visit drcrista.com. That's drcrista, CRISTA.com. drcrista.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.